Good afternoon, everyone. Welcome to the Mayor's Town Hall regarding COVID-19 and all things Alameda. Today, the Mayor doesn't have any speakers planned. We're just going to have a Q&A with Mayor Marilyn Ezzy Ashcraft. And so we invite you to participate as normal. If you want to have a question or a comment, put it in the chat screen and we'll go ahead and read it to the Mayor and she'll answer your questions there. If you're listening to us on Facebook Live, you can also add a question or a comment to the Facebook live stream and we'll try to hear those as well. I'd now like to turn today's meeting over to Marilyn Ezzy Ashcraft.
Hi, everyone, and greetings. Thank you for joining us on, wow, just another challenging day. It is nice to see the sun out because I think it just lifts our spirits when we see the sunshine because, as you know, we had a couple of very strange, eerie days when we didn't. But I hope you're also paying attention to the air quality numbers. And in fact, you should have gotten a text message today about how bad the air quality is. So please stay inside as often as you can. Be sure to wear your mask as you should be anyway when you're outside. And before we get started, and I'll talk to you about some local things going on in our region, I do also just want to pause to remember that today is September the 11th, and it is the 19th anniversary of the attacks on our nation and the Twin Towers and all the things that happened that day. Maybe it's also a reminder of what a resilient nation and people we are, and we rise again and we work through crises and difficulties, and we are always stronger together, looking for those shared solutions, not attacking each other, but collaborating. And I always hope for a better tomorrow. And in fact, just talking in terms of the forecast, I was on the National Weather Service site this morning. And so while it's good news that the sun is out, because it means that layer of smoke isn't quite so thick that was blocking out the sun a couple days ago, until this smoke has a way to get out of here with some winds carrying it away, but not too much wind because we don't want to feed any fires. We're going to be in some times like this, although the forecast is that tonight is supposed to get clear. We're going to apparently go through this pattern of smoky during the day, clear at night through Sunday, according to the National Weather Service, and then next week should be much better and much clearer. So do what you need to do to protect yourselves. I know for anyone who already has asthma or some sort of breathing pulmonary issues, this can be really challenging. And I do want everyone to know that the Alameda Public Library on our main branch there on Oak Street at Lincoln has been open since 10 this morning. Will be open until 5 tonight. It is a clean air site. We've got those good HEPA filters in there. So, and they're following all the COVID-19 protocols. You'll have your temperature taken when you come in. You've got to wear a mask while you're there. But if you live in like a drafty home or you're unsheltered, get yourself over to the library. And a big shout out to Library Director Jane Shisaki and her library staff who are making that happen. So it's not all bleak news. You know that I always want to talk to you a little bit about COVID-19. And for the first time these last couple weeks, we are seeing a downward trend in the number of new COVID-19 cases in Alameda County. And so just yesterday, I think it was, if not the day before, nope, it was yesterday, I got a bulletin from our public health department, and they showed, and there's graphs that show the downward trend, and we're still in that purple category. I think you know that we've now gone to this 4-tiered identified by number category, and Alameda County is in the purple, which is the highest, most restrictive because we have the highest number of COVID cases per capita, but we can move into the next lower tier, the red tier, when our case count per 100,000 residents is below 7. So 7 new cases, no more than 7 new cases, or just below, so it must be like 6.99 new cases per 100,000, and it's county-wide. Right now, our county is at 7.8. So you can see that is an attainable goal. And the fact that we were trending downward for these last couple of weeks tells me we can continue to do it. I want to give a big shout out of thanks to Alamedans because I think the majority of you are really working hard to comply. I see that when I'm out and about. Now, we did just have the Labor Day weekend, and you always have to project out about 2 weeks. We'll wait 2 weeks to see, because that's the outside incubation period to see, did new cases come about as a result of that. I did not go to the beach this weekend, but I heard some reports that there were a lot of people out there. Many were wearing masks. So I like to think that, but the numbers will tell us the truth. And then when we get to below 7 new cases per 100,000 residents, we need to stay at that level or lower for 3 weeks, and then we can do things like schools can apply to be allowed to open. There's a procedure for that that I will leave to the schools, but more businesses can open, and we can just be freed up to go out and about and do the things we love to do. And I do want to just say to our businesses, wow, just when the restaurants were allowed to open for outdoor dining, we have air quality that tells you it's not healthy to be outside. And of course, we don't want our servers who are essential workers or our customers sitting outside eating, but you can still do what my husband and I are doing tonight. We are ordering takeout from some local restaurant. Normally we walk from our house to wherever that is. We're not going to walk tonight. You should not be out walking when the air quality index says unhealthy for all. But you can still support your local businesses, right? You don't have to cook and leave a hefty tip. And try to go pick up your meal if you're at all able to, because right now, if you use a delivery service, they charge the restaurants a fee. So, and I also want to congratulate Alamedans and, I think Northern Californians in general for not having to go into rolling blackouts a week ago. You remember when we were just going through that horrendous heat wave? It's like, what haven't we been through lately? And we had an earthquake in all of that. But because you all heeded the call from the California Independent System Operator that operates the grid that brings the power into Alameda, because remember, even though we own our own municipal utility company and we are clean green sourced, we transmit across the island on amp lines, but into the island we have to use PG&E, and we're on the grid. But you cut back. You either didn't use your large appliances or you didn't use them during those critical time periods, which I think is like from 3 p.m. to 10 p.m. So good on you. That kept us from going into rolling blackouts. And for the counties that did have to, because they were in high fire danger areas with the winds and everything, even when the rolling blackout was over, I read that it was taking PG&E crews much longer to get in to do the work to get them back in operation because of all the smoke that was just making it difficult for workers to be out. So it's best not to have to go on the rolling blackout at all. I want to remind everyone that the census count must be completed by the end of this month. September 30th is the accelerated date that the White House gave us, but it's so important to get your census completed. So please do that. If you know anyone who hasn't, it's so easy to do it, and I bet the amazing Sarah Henry will even put up in the chat box sometime during this she anticipates my next move at all times. And then the other thing that's on people's minds, I know certainly mine, is you may have heard there's this election coming up in November, and we want to make sure that every vote is counted. We want you to feel secure about your vote. And so at our next town hall, next Friday, right, Sarah?
Hmm.
The 18th, so September 18th, 12 o'clock noon, Sarah has put a great lineup together for us. We have our own registrar of voters, city clerk, Laura Weisiger, but we also have the Alameda County Registrar of Voters. Oh, Brian what's his last name? He will be our guest, and we are working on a representative from the U.S. Postal Service because we want to hear from them. We want them to be able to. We want you to be able to have your questions answered because this is just so important. And Laura will have more up-to-date information for you about how you can vote, all the different ways you can vote in Alameda. It's going to look a little different this year, but very safe, very secure. So that's next Friday, September the 18th. So I think with that, I am ready to open the floor to your questions. What do we
Great.
think,
And I'm
Sarah?
posting right now into the chat the link to the town hall for next week, so folks can see the Zoom information and get that on their calendars too. We have a couple of questions, Mayor. To start, a couple of questions with regards to Halloween. It's kind of two themes. One is just what is some safe Halloween guidance? How can neighborhoods best publicize? And then the other is how we're going to enforce trick-or-treating.
Oh dear. Yeah, this, it's amazing the things that have come my way this year. We had to kind of cancel 4th of July, as you remember. We didn't do our usual wonderful parade. And with Halloween, so once a month, all of the mayors in Alameda County, there's 14 of us, we have a meeting, the Alameda County Mayors Conference, and we met this past Wednesday and had lots of things to discuss, but Halloween was one of them. And I jokingly said, I don't want to be known as the Grinch who stole Halloween, but I also don't want to see our COVID numbers rise after Halloween. And I know you're going to say, oh, but the data talks about how children don't tend to get as sick if they get COVID, although there is that inflammatory condition that sounds kind of scary. But the things to remember are, I don't know about your neighborhoods. I'm sure every neighborhood is different, but my neighborhood, I live on a busy street. I love trick or treat. I love to see the kids, the little ones, the medium-sized ones, the ones that are bigger than me with no costume and just the pillowcase for the candy. I don't care. I like kids to have a good, safe place to trick or treat. But if you look down my street on Halloween, a typical Halloween, you couldn't see across the street. It is just shoulder to shoulder people. And that's not a good thing. And they're not all little kids. And they come up on the porch and you know, you hand the candy or put it in the bag. You can't be 6 feet away. My arm is not 6 feet away. So and I'm just seeing what other counties, like LA County has put out guidelines that that's not a good thing to do. I am going to reach out to the Alameda County Public Health Department, see what our public health officer recommends. I do remember when my kids were little, I've got twins, they're 29 now, but I used to make their costumes every year. It was totally fun. It's a really big deal. And of course, school's not even in session physically, so the schoolyard parade or whatever isn't going to happen. I know I heard from one of our teachers, an elementary teacher, who said, well, what if, you know, neighborhoods could arrange these like parades of the kids down the sidewalk and not anybody give out candy or parents give out candy to their own kids. I mean, that would be fine, I'm sure. The problem is, at least on my street and some of the kind of busier streets and maybe the wider ones that are easier to for people to drive to, it's not just neighborhood kids. Kids and families come from out of town, which I've never minded because again, I want everybody to have a safe place to trick or treat. But this year, safety also encompasses COVID and protection from COVID. And again, we've got to get past the numbers so that our schools can reopen and our kids can go back to school because they are suffering not being in school and away from their peers. But teachers and students and parents and staff, they all have to know it's safe to go back. We got to get those numbers down. Our business community, as I've said, has already suffered greatly. People need to go back to work. The assistance checks from the government, as you know, have been reduced and people are just struggling on so many fronts. So we may have to make some sacrifices. As far as enforcement, oh my goodness, that would be a real nightmare on Halloween. I would hope that it would be the sort of thing that parent groups and neighborhood associations or whatever come up with ideas. Email me your ideas. Email Sarah too. We're reaching out to the school district. I know, well, I'll throw out an idea that I was talking to our Recreation Parks Director, Amy Wooldridge, a month or so ago, because this has been on my radar screen. And she suggested that, well, something ARPD could do if parents want, if they set up a process whereby parents could register your child, how many you have, what their ages are, and then I don't know, Halloween elves at ARPD could go around on Halloween and drop off trick-or-treat bags to the kids. Does that make up for not having that pillowcase full of candy? Probably not, but it's probably better for your teeth. But I mean, that would be one way that we could get treats out to Alameda kids who wanted to participate. But again, those are my concerns. I welcome you. Let's crowdsource this one, people. Help me come up with Halloween solutions.
Great. So no solutions yet, but we'll keep
No,
tracking them as they come in.
it's
Um,
September. We've got more than a month.
Here's the next question. Given that our city's COVID-19 daily case numbers from the Public Health Department have been increasing, sometimes over 20 new cases per day, and the fact that we have not flattened the curve within our city, in fact, a chart of our daily total cases showed increasing steepness, does it make sense for our city to open with the rest of the county?
So everything that cities do is what the county does. I can tell you that without going into any HIPAA, we did have an outbreak in one of our nursing homes, and that will cause case numbers to rise. And so what I look at, and yes, the charts have gotten better, so you can see those daily spikes. But I also look at our per capita numbers relative to the rest of the county, and I will confess to not having looked at them for a couple of days. It's been a little busy in my office, but we have hovered around the fourth lowest per capita rate in the county. So. As far as businesses reopening, I mean, the way they've been allowed to, as long as they're doing it in that smart manner that they are compliant, and I know I was on the business town hall earlier this week, and I won't do it today, but I did call out some restaurants on one of our downtown streets that when I was walking home from picking up my takeout dinner last Saturday evening, people were out there like it was 2019, just chatting away and not wearing masks. Not every block, because some of the restaurants on another block of the street were completely compliant. So we can open safely, but it's not rocket science. You wear your mask at all times when you leave your house. If you go to eat out, only when you're eating and drinking do you take your mask off. When you're chit-chatting with your companions, you wear your mask. When the server approaches your table, you wear your mask. And we now know the science has evolved. Masks protect not only other people from what you might be spreading, but protect you from particles in the air too. But we have to be considerate of people who are these essential workers, servers. So if I see no problem with opening under the county public health guidelines, which is what I just said, and even the chairman of the Federal Reserve this week was interviewed on NPR, and even he said that the most effective thing we can do to get the economy up and running, and again, the chairman of the Federal Reserve, is to follow the guidelines to wear masks in public, maintain social distance of 6 feet, and wash your hands frequently, because short of a vaccine, this is the most effective thing that is going to bring our economy back toward normal, and it's far from normal right now. So let's do it.
A next question asked what our response was for the census. And so if it's okay, Mayor, I can
Oh,
share my screen
yeah,
and I
do,
can
because
show you.
I was
And
wondering too. I want to hope we're higher than the county average.
we are.
Yeah, we are. But
It's
that's
still,
78. We don't want to leave any money on the table, and that's what it is, because this is funding for school lunch programs, hospitals, fire services, affordable housing, so many things are dependent on the census. So if you possibly work in a community that might be a harder to count community, please, reach back out to us. On our staff, Anna Bagtus has done a masterful job of getting census data out. And then, of course, census workers are going door to door now, but that's even tough in these conditions. But please, let's get that 22% counted. We don't want to leave money on the table. But
Next,
78%. Okay.
we can do better.
We can do
Um,
better. Yeah.
Various businesses are getting harassed by anti-maskers who are demanding payment for being discriminated against because they're forced to wear masks. Can the city or chamber put out some guidance for businesses on how to respond to this?
Whoa, read that one again. They're
Yeah.
being harassed?
They're being harassed by anti-maskers who are demanding payment for being discriminated against. So they go to a restaurant, they're forced to leave because they're not wearing a mask, and then they're demanding some sort of payment.
Well, what I would say is if anyone gets truly abusive, violent, call the police. Uh, please do not pay anyone. And that is just unfortunate. I mean, it doesn't make sense. I had not heard that. So that's definitely the sort of thing, even after the fact, you can reach out to the police department, to the non-emergency number, and just give a report because it helps them to see a pattern of where this might be happening. That's the first time I've heard of that, and that is disappointing. But no, it is absolutely not only the right but the duty of a business, whether you're a grocery store or a restaurant or a bookstore or what have you, to require that compliance before someone um, comes into your business. But we don't want you to put yourself in harm's way. So if you feel that someone is being abusive and possibly violent, call the police right then.
So I only have one other question
Oh,
that's come in. So anybody that has a question,
sure.
please submit it. Can we get rallies to keep the Nob Hill post office? This person
Rayleigh's.
understands, yeah, Rayleigh's. Can we get Rayleigh's to keep the Nob Hill post office? I understand that they think it isn't cost effective. Do they know we will shop where the post office is? At least keep it through December.
This is interesting. I was on a conference call earlier this week with Congresswoman Barbara Lee. Every so often, she'll have a conference call with the 7 mayors in her district and Alameda's in her district. And someone did raise that the post office had been closed. Wait, maybe now I'm not sure that because it would have been me who raised it, and I only learned about that. Maybe it was the business town hall or something. But let me do this. What I don't know is it Rayleigh's that is deciding to close the post office, or is it the U.S. Postal Service? But that is a good question for the Congresswoman's office. And so, Sarah, we can do an email to her district chief of staff. That's Tatiana, who was
Yep.
on the call the other day, and we'll let them know about it because something that one of my fellow mayors, Libby Schaff from Oakland, raised, and you've read about this, I'm sure, that the Postal Service before Congress, at least the Democrats in Congress, said time out, was removing mailboxes, the blue mailboxes, drop boxes on corners, and things like rapid sorting machines from post offices. In Oakland, apparently around downtown, a half a dozen mailboxes had been removed, which is, a half dozen less mailboxes for people to mail, well, their bills, but also their vote by mail ballot. So Mayor Schaaf, working with Congresswoman Lee's office, got the post office to return those mailboxes. The rationale that was given was that they were concerned that they would be damaged in a riot, but there was no evidence of any mailboxes being damaged in previous civil unrest that happened in Oakland. So we'll look into that and see what the story is. And hopefully we'll have that representative from the U.S. Postal Service on the town hall next week.
Yeah. So a few more questions.
Okay.
Next
So I don't
up,
have to tell jokes or something. That's good. Or saying you're all really fortunate. What have we got?
the next person is asking about testing, specifically COVID testing in Alameda.
Yeah. So right now, things like walk up and drive through testing has apparently been halted. That was in the county public health bulletin from yesterday because of the poor air quality. I know our assistant city manager, Jerry Bowden, has been working on a couple of possibilities. One is with the entity that UC San Francisco used to set up its testing facilities around San Francisco, and that's a group called One Medical. And I know he made the connection because I actually helped connect him. And I think that what he heard, and I'll have to check with Jerry, is that there is, we're in the queue, but there's a bit of a wait list. Um, I would like it, I would very much like to have testing locally. Um, so we're working on that. There's another possibility, but that's a little more remote, so I'm not even going to talk about it. But I will say part of the good news that came out of this public health bulletin that we got yesterday was that our county's positivity rate, so of all the tests that are done, the positivity rate is 5%. So that means only 5% of people are turning up positive. That is a very good thing because the positivity rate you have to achieve to move, there's a number of factors you have to achieve to move down the ladder to the next tier is 8. And we're already below 8. We're at 5%. So that's a good thing. I'm also looking forward to the day when we have wider access to things like the saliva test. You may have heard that Abbott Labs, which has a facility in Alameda out at the Harbor Bay Business Park, just had the FDA approve their saliva test, but it's only for use in doctor's offices. I do know that some college campuses are using these to test students in their dorms on a regular basis to make sure that things are safe. So we continue to work on that. The good news and the bad news is countywide, we fell down in the queue because our positivity, our per capita rate of cases was so much better than communities like Oakland, Hayward, San Leandro, Union City. But I don't want our residents to have to travel long distances, especially in these conditions. So we will keep working on it.
Great. Next question is a precursor for next week. Will there be more county boxes in Alameda to drop off ballots?
Short answer, yes. And you'll get more. Not only will you know, should you know how many, but you'll know their locations. Yes. And I will also say that the Registrar of Voters is looking for people who can be poll workers on election day. So Sarah, I just know we'll get that.
I've signed up myself, and so I will
Wow,
send the
good
link.
for you. I've done it in the past. It's really an awesome experience. And you don't want to be in one of the high risk categories because they will have all the protections for you, but nonetheless, you will be an essential worker that day. The facilities they're looking at are going to be larger so that you will be able to socially distance. There will be all the protocols in place. We'll hear about that from the Registrar of Voters next week. But again, they need people to staff these. And I just put out an email last night to the youth activists of Alameda, who are this awesome high school group and they're from our high schools across the island, but they just want, it's always, Mayor, what can we do? What can we do? We want to be involved. And so I sent them, Sarah, I'll share with you, the U.S. Conference of Mayors is doing this series about voter engagement and getting youth involved. And so I sent them the video that I haven't even had a chance to watch, but it's this is an effort. Valerie Jarrett, who worked in the Obama administration, is involved in it, and I'm going blank on the name, but it's it's nonpartisan. It's just get the vote out. And so anyway, I told them the Registrar of Voters is looking for workers, and you get paid, so reach out to them.
This next person is asking for an update on the plans for Marina Village Inn to be used for housing.
Yeah, I was talking to a resident from that neighborhood, maybe it was last week, but I did tell him that I think the city did not do as good a job as we could have and should have in messaging about this. It is a county effort, but nonetheless, it's in our city and we know about it. And so what it is, statewide, there's something called Project Room Key. And Project Room Key has a number of missions, but one of them is with COVID, they want to make sure that people, our unsheltered population, are not living in unsafe, well, it's already unsafe if you're living under a freeway overpass, but are not even more susceptible to transmitting or getting COVID-19. So outreach workers go around and they interview and they screen for people who would work well in a situation like being housed in a hotel or motel. And then also in Alameda, we have a shelter for victims of domestic violence and their children called Midway Shelter, but we needed to thin out the population. And again, none of these people tested positive or showed symptoms of COVID-19, but we needed to get them out of a situation so that it didn't become a place where you might get COVID. So at the same time, as you might imagine, the hospitality industry has been hit hard. So the county, with funds from the state, went around to see what hotels and motels might be interested in entering a contract with Project Room Key. And Marina Village Inn was one that was chosen. And so there is a combination of folks living there who are formerly unsheltered and also some of our residents from the Midway Shelter. Now, the county model is that there are caseworkers, that they're working with these unsheltered individuals, and also Operation Dignity, Building Futures, I should say, works with the Midway Shelter population. So they're working with caseworkers, and the idea is to help get them resources they need and to help get them eventually into a permanent housing situation. So the problem that arose is that it takes a little more supervision than we were getting, but as soon as we heard about problems of panhandling, litter, just some concerns that neighbors were having, we reached out to the county and Building Futures, and they committed, and our city, Anna Bagtus, who oversees this, to do more on-site supervision because there is an on-site manager. But now it's looking like with additional money that's come out, the county made a bid to actually buy the Marina Village Inn. I haven't heard yet if that was finalized, but this would be someplace to provide this transitional housing until we're able to move people into more stable, permanent roofs over their head. So it's a good thing. It needs to be carefully managed and carefully supervised, and we always need to make sure we're keeping up the communication part.
The next question is saying that people with medical exemptions from masks are being accosted and harassed by citizens. Why does Alameda's public awareness campaign ignore medical exemptions from masks?
I'm actually not aware of a medical exemption for a mask. And I, harassed by citizens, I'm not sure what that means. If you have a medical exemption that says you shouldn't wear a mask or can't wear a mask, I would imagine you wouldn't want to be leaving your house during times of COVID because you will be susceptible to COVID-19. So if you have a medical condition, that there are people who just should not be out and about during COVID, and we've said that from the beginning. If you have a compromised immune system, if you're over a certain age, you shouldn't be out there. And I do want to take this opportunity to remind everybody to get your flu shots, because that's the other thing the county public health officers are all just amplifying the message. We do not want to have a flu epidemic on top of a COVID pandemic. And the good news is the precautions you're taking against COVID-19, wearing your mask in public, um, maintaining your 6 feet of social distance from people you don't live with, and washing your hands frequently, that protects you from the flu too. And we're seeing countries in the southern hemisphere where the flu season is underway and actually starting to wrap up, that they've had a lighter than normal flu season this year, and they attribute it to these precautions that you're taking for COVID-19. So just keep protecting yourselves, protecting others, but get your flu shot and get it early. It's September, they're available now. You can go to CVS, Walgreens, or call your doctor or clinic where you get your health care, but get your flu shot.
The last comment we've kind of already addressed with the testing question. I'll just read it. This person says that competent data is needed for adequate response planning. What is the chance of getting planned statistically competent testing in Alameda? In the past, UCSF has offered free lab work for such programs.
To do planning and planning for like reopening.
Response planning. Yeah, I think for reopening planning.
Yeah, when we had a town hall a couple weeks ago, maybe it's been a month, about the schools reopening, what it would look like. I did, and I believe we had at least one pediatrician mom on the town hall, and I remember, saying that how will schools do things like testing? It can be very costly, but since then, this saliva test has become more available. But the pediatrician also reminded us that any COVID test is that snapshot in time. So you might be negative one day, but it doesn't mean you stop taking precautions. You might even test positive, and you might have the horrible experience of having COVID, or you might be one of those people who are asymptomatic and didn't realize you had it. But it doesn't provide immunity, apparently, because from getting it again, because we've seen, I think in China, cases of people who definitely had it, who then had it again. Whether perhaps you don't get it as bad the next time, I don't know. But yeah, the testing, I mean, we need to do testing because before people can go back to work in these settings, they need to know. And whatever can be done and done at no cost would be great. And right now, I believe, because I was just on a town hall with Ricardo Lara, our state insurance commissioner, and you are not supposed to be charged for COVID-19 testing now. Insurers are supposed to pick up that cost.
So the last question is asking if you have any information on the string of break-ins on Webster Street last night.
I just got word of that as we were going live, and I do not. I will grab my phone and see if there's anything I can tell you that's come up on my email. Sarah, you would know more. Was this while they were open for business, or?
What I saw was on Facebook, some photos, and it looks like they were broken into in the evening, not when they're open.
Not when people were there. That is the first I've heard about that, and I'm very sorry to hear about that. I'm sure these businesses have made their police reports. If you have security camera footage, that's always helpful for the police. Wow, just challenges for businesses right now. Challenges for all of us. And I just want to quickly say that don't hesitate to reach out for help with mental health issues, anxiety, depression. It is completely normal to be feeling that way when we've gone through so much. I joke that we're all going to be very resilient when this is all over, but it is no joke that it impacts us all. Not to even, I mean, I generally take a walk every evening, the early evening with my husband, and we haven't been able to do that because nobody should be out taking a walk right now, please. But last night I was just feeling so cooped up. I walked around my house until I'd walked a mile. Um, I looked kind of like a crazy woman, but I just needed to move and I couldn't go outside. But the Alameda Family Services is a great resource, and their website, I bet you Sarah's going to put it up in the chat box, or whoever your healthcare practitioner is, talk to them, reach out about that. Keep an eye on the kids. Children of all ages are experiencing anxiety. So we're going to get through this, but it doesn't mean that we can't seek help along the way.
So one last comment came in, and they said, in addition to mask wearing and isolation, the most critical thing to control the virus is for our county health department to test, trace, and isolate so the virus can be controlled, so we know where the virus is and we can get back to having the freedom to work, shop, and live safely.
Yes, very smart comment. You're absolutely right. They are working on all of those things. And then in some communities that have been especially hard hit, and we aren't one of them, but in parts of Oakland, I know, the county has come up with a fund so that they can actually pay people stipends because who have been tested positive and must remain isolated, because one of the things, the problems we've had is that people who rely on their job for the paycheck to keep, to feed their family and pay their rent, if their income is cut off because they can't go to work and they don't have benefits that cover them while they're out sick, they might be tempted to go back to work, or, live with people and spread the disease to them. So there is a stipend now available for people. You have to meet certain criteria. But absolutely, it's the contact tracing, the testing, the contact tracing, and isolation until you've passed the incubation period.
And then
Absolutely.
just the last question, and then we don't have any more, but they were just,
Okay.
again, asking about testing and when here, and I know that you've already addressed that.
No,
So.
I know. Whenever we've got more information, but I will, trust me, I made a note of it, and I'm going to email Mr. Bowden when this is over, and whenever we get word that we're opening a testing site, Sarah is, she's all over it with blasting out messages, but we'll talk about it on the next town hall too.
That sounds good.
Right. Okay, so let's crowdsource Halloween solutions, everyone. Send Sarah and me, send your brilliant thoughts. I don't know, virtual parades, I don't know, but something. And stay safe, wear your mask, stay indoors until the air quality gets better, hopefully by the end of this weekend, and maybe maybe even tonight it'll be a little better. They say clear, whatever that means, but definitely check the air quality index before you do anything outside. And don't do anything outside without a mask on. Thank you so much, everyone, for joining us. It's always nice to see you. Take care, stay safe. We'll see you at the next town hall. Thanks so much, Sarah.
Bye, everyone. Thank you.
Bye-bye.